So Heidi, President is saying he wants to get us up to 300,000 jabs a day. We're currently on around 80,000, which isn't too bad. Is the Health Department confident that they can do what the President is asking?
Well, they're saying 300,000 is a far reach, given the fact that we are only on 85,000. But what's key here is the fact that the country is going to be getting more vaccines. And they were banking on that initially when phase 2 started out. And our vaccine rollout would have actually been double from what it is now. But we were only having Pfizer to administer for phase 2. So the Health Department is saying that by mid next week, the end of next week, we will have doubled vaccines administered. So we're currently on about 85,000. We will be over 100,000 vaccines administered. And that's all because we do understand that more Johnson & Johnson vaccines will be administered. So the President is very hopeful, but hopefully we'll get there at some stage, but not now, says the Department of Health. Let's listen to further what they had to say.
We have access to Johnson & Johnson vaccine from next week. The President announced that, and indeed that is the case. So we are now able to ramp up very quickly because the provincial administrations and some of the private providers have been champing at the bit to open new sites and to increase the volumes at their sites, and they were only constrained by the fact that there was not vaccine in the environment. So we do indeed expect to double. It won't happen on the first day, because we've still got to get the vaccine down the delivery chain and into the system. And there's some reorganization of sites that have to happen, especially for the public sector administrations. But certainly by midweek to end of next week, we expect to be at least double what we are currently vaccinating, and the week after that, even more.
You also asked Nicholas Crisp about glitches in the system, you know, people who've registered but they haven't received appointment dates. What's he saying?
Yes, so many people have been complaining and saying that they were the first to register for the vaccine on EVDS, but they still don't have an SMS and they don't know what to do. But the Department of Health says it's critical for everybody to understand the fact that government had budgeted for the fact that we would be getting the over 2 million. That's why they were accepting so many registrations. They had queued everybody up. But now that there was only one vaccine, it meant that there was actually a virtual queue. So what happened was those that had registered the very first day were in a queue of about 30,000 people. And if one vaccination site is vaccinating about 1,000 people per day, it's going to take about 30 days until they reach that person that registered that's part of the 30,000. So if you look at things virtually, it does make a lot of sense. And there's a lot of frustration on the ground as to why people aren't getting their SMSs. But things are going to speed up. And we've been hearing about this constantly. Things are going to speed up. It's going to get a lot better. Hopefully, Sally, we'll be seeing that next week because Johnson & Johnson is going to be administered. And as soon as they are satisfied with the number of people that have been vaccinated in phase 2, those that are 60 and above, specifically the elderly and those that are at risk, they are going to start moving into other phases of phase 2 and, of course, the next phases. Let's listen to the department once again.
The fact of the matter is, had we had vaccine in the quantities that we thought we would have before the J&J disaster or semi-disaster happened, those queues would have been short. But we didn't have those 2 million doses in the system, and therefore we are 2 million doses behind on where we would have liked to have been by now. So what happened is that we registered 3.5 to almost 3.7 million people, of which part of that registration happened during the Sosonke period. But right now there are 3.7 million people. 479,000 people were vaccinated during the Sosonke trial. And since then, we are now well over we're close to 1.5 million are vaccinated. But that means the difference between the 1.5 and the over 3 million registered are still waiting for messages. So the queue is extremely long. And until we get the vaccine into the distribution chain and down into the periphery, the queues remain long. And what people, I think, find hard to believe is that because the queue is not visible, it's virtual, it's sitting in the computer system, it's quite hard to recognize that some of these queues are 30 or 40,000 people long. And even if that site is vaccinating 1,000 a day, it means you're 30 days before you are going to be given an appointment.
All right, so the virtual queue is long, and I guess I see his reasoning, but at the same time in Gauteng, the message is if you're prepared to walk in without an appointment, that's fine. It seems a little counterintuitive.
Yes, especially because Gauteng is experiencing a third wave and the numbers are so high. Most of the positive COVID-19 numbers are in the Gauteng province. So we actually asked the National Department of Health why the province would actually allow for walk-ins, given you're going to put the elderly and those that are most at risk exposed in these long queues. We don't know what it's going to look like. Of course, the Gauteng Health Department needs to answer as to what prompted this decision and why they decided to allow this.
So to be clear, if you're in Gauteng and you've registered and you're over 60 and you fancy it, going along and taking your chances, you can't be turned away because you're walking in.
No, you should not even
that's
have
good
been,
news,
you should have not even have been turned away even before they sent out this notice, because if you're elderly, you are at most risk and they need to accommodate
It's important. I mean, that is important to know, because we both know people who were turned away because they didn't have the right voucher. Very quickly, Heidi, we're waiting for these 300,000 odd Johnson & Johnson special delivery of that batch coming in ahead of all the others for the teachers and support staff. Now, Aspen told us 2 days ago it was coming by yesterday or overnight, but we haven't seen it yet. Do you have any idea when it might be arriving?
So we know the National Department of Health has said that those vaccines are not in the country as yet, but they are coming. That's all we have at this stage. But what's going to be critical is for those vaccines to arrive as quickly as possible, because it's not just them arriving and then they administer them immediately. They need to be taken to the plant in Midrand and then transported to the various provinces. So it's a massive logistical task, but we don't have an exact date. But I trust you. But trust me, if we do have that date, I'll be at the airport waiting for those vaccines.
Absolutely. We know you will. Thank you so much, Heidi Giokos.